What are the risk factors of addiction? More specifically, what causes a teen or a young adult to become addicted to a substance in the first place? Well, in this video, you'll hear from Sarah Fletcher, the Chief Clinical Officer at Sandstone Care, as she walks us through how teens or young adults become addicted and what to do about it. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges with substance use, addiction, and mental health conditions. All right, let's get right to it. Another common question that we see parents have is, what are some of the risk factors for addiction? Like, what causes a teen or a young adult to become addicted in the first place?
Yeah, absolutely. So I think when we look at substance use in general, and what kind of brings on a substance use disorder, in my mind, we look at where does that scale kind of tip, or where do we cross that line? Most of the time, when adolescents first start using substances, it's really coming from an experimentation stage. And so for me, and not to get on a little bit of a soapbox, but this is where education is huge. I can't tell you how many clients that I've worked with who come to me and we talk about how they first started using substances. And what they were told early on is that if they use a certain substance, they're going to immediately become addicted to it. Their life is going to turn upside down and everything's going to be terrible. Well, what happens is then when they experiment, they're with friends or they're with their older siblings or whatever the situation is, they experiment with a substance and they don't experience any negative consequences. What happens then is that any sort of education that they've received is now not credible, because they learned that by doing this, I used marijuana one time, nothing bad happened to me. In fact, I experienced some positive euphoria from that substance. And so when we look at experimentation versus moving into a true substance abuse or substance use disorder, I really like to press on early onset education and truth behind substance use. Most of the time, if adolescents try a substance, they aren't going to become heavily addicted. They're not going to gain a super high tolerance. That's not to say the substance isn't dangerous and that it can't have negative consequences. But I think we really need to be honest about what those consequences are and what the risk factors are, because what we're doing is we're undermining our own credibility. Then when an adolescent uses a substance and nothing bad happens to them, they become invincible, right? They're like, well, I can do this and I can get away with it. And so what we're really looking for in crossing that line is, when does experimentation become frequent use? And also looking for factors of, again, looking for those predisposition of genetics, looking for early onset mental health. And so does this person struggle with depression? Do they struggle with anxiety? Because the reason that I bring that up is those who struggle with anxiety and depression, using substances can become a really good coping skill. It's not a healthy coping skill, right? And it can also lead to really serious addiction. And when we're not taught early coping skills of how to manage feeling hopeless or feeling really anxious, we start to use those substances and they help. And so it really, what we're looking for in how someone becomes addicted is we're looking for a form of self-soothing and self-medication. And then when does that experimentation become a problem? So the other thing is, a lot of times adolescents feel, again, invincible, and they also think that they can get away with everything. We think we're really smart when we're teenagers, and to be honest, we're incredibly clever. And so when adolescents get caught using substances or partying with their friends, I think the biggest mistake that oftentimes happens is we go straight to punishment and consequences and we skip that education piece. So again, that's where that communication comes in of, yes, this is an unacceptable behavior and we don't want this to continue to happen. And let's talk realistically about what substance you're using. And frankly, what's the reasoning behind the use? And that really leads us to a rich education dialogue where we can talk about natural consequences and risk factors. Hey, this is actually what could happen to you down the line. And so I think the education system has done a really wonderful job in kind of doing a pivot from the early education, the education that Clint, you and I likely had growing up, was if you use any sort of drugs, you're probably going to die. And it's like, well, probably not. And using illegal substances or mood altering substances in excess can have really dangerous consequences. And so again, looking at education and really talking about what's realistic and looking at when we pass an experimentation mode and move into frequent use.
Yeah, and so the thing that sticks out when you say that is education is a two-way street. On the one hand, you are trying to make sure before you give any punishments that you are giving education, right? That you're letting people know the reality of the situation. You're letting your kid know the reality of the situation. But then the other part about that education is you learning, right? You as the parent are learning why the child is doing this. What is the thing that they're trying to cope with, right? Like what is the experiences or the events that are happening in their life that are causing them to react, right? Because if you think about it, you're not going to be able to help that child to not use that substance if you don't first know why they're using the substance in the first place. Is that right?
%. Yeah, we really want to come from a place, again, to understand what's really happening with your kid. And that can be really, really tough, especially going through adolescence and trying to figure out your own sense of identity and who you are. It's really, really important that, again, I'm not saying that consequences aren't necessary. And to your point, it is a two-way street. We need to understand what's backing those decisions and make sure that we're supportive in finding out a way to be able to kind of curve those decisions so we come to a place where we both understand each other. The other thing I think is important is when we do give consequences, especially when it's surrounding substance use, we want to make sure that we're educating the why behind it. Hey, this is the consequence for the behavior that you presented. And I want you to understand why I feel nervous and why I'm scared about this behavior. And so again, it doesn't come from a place of you're wrong, you didn't do this right. It really comes from a place of I want to keep you safe because I love you and I care about you. And I also want to understand what's happening for you because I recognize that I don't know.
So powerful. It's such a powerful thing, and it's almost disarming to come to the table of wanting to actually learn. And I think you mentioned being curious, right? Coming to the table being curious from the get-go to actually want to know the answers. I think oftentimes when we go into a conversation, it's not about trying to learn, it's about trying to inform, which usually doesn't end up well, does it, right? Like, have you seen that? Like, where a parent is so sure of what needs to be done and they seek out professional help, not necessarily because they don't think they know what to do, but because they just want somebody else to validate what they know they need to be doing. Have you seen that before?
And I think that's really common in what we see when we work with families and adolescents is that we have parents, again, coming from a place of fear, right? They see that this behavior is not good, and they see that their child's behavior and their mood swings and who they are as a person is starting to adjust, and they want to be in control of that. And I totally understand that because at the end of the day, you want to keep your child safe because you love them and you care about them. And I think that that's where those assumptions come in. And oftentimes when professional help is happening during family sessions, the first session is really just identifying what goals we have, opening the session, setting some ground rules around our nonverbal cues or how we communicate with each other, and then really just talking about what we want from the session. Most of the time parents come in and they have a number one goal of, I want my kid to stop using marijuana. Well, that's only one piece of the puzzle, and we can absolutely set that as a goal, but then reverting back to, let's find out why your kid feels like marijuana is a good coping skill for them. And again, letting families express their resentments and really make sure that they're receiving their own support is incredibly important in the process.
And that's what I really love about this show, this podcast, the videos and the stuff and the content that we're creating is that so much of it is about education, right? It's about us knowing the right thing to do as parents or as adults to support teens and young adults. And oftentimes when we know better, we do better, right? And so in general, there's a huge need for education. And sometimes that means that as adults, we have to go back and relearn ourselves, right? Like we actually have to take a step back, look at ourselves. And I think when you talked about coming from a place of fear, that's scary because you're afraid that if you look deep enough into the situation, you're going to find that some of the issue might be a result of things that you have done in the environment. And that is a hard thing because of course you want your kids to be healthy and happy and live beautiful, great lives. But on the other hand, if there's any sadness going into their life, you wonder, is there some part about this that's with me? And so there's that, like one, neglecting your own responsibility. But then I would imagine, Sarah, that there's also people who blame themselves, kind of like we talked about earlier, for everything, right? So is there like an other side to that coin?
Yeah, when I meet with people and they try to convince me that they're not bad parents or that this isn't their fault, I think the biggest piece for me is just removing all sorts of blame from the conversation. And I like to compare this to any other disease. We don't blame cancer patients for getting cancer. It's not their fault. Same thing goes with addiction and mental health. We can't blame the parents or the child or the friends for introducing or developing a substance use disorder or a mental health disorder. Yes, there are natural environmental factors that play into the development of addiction. That also doesn't mean that if you adjust course and you pick up and move to a different state, it doesn't remove the predisposition of what your child is struggling with. And it doesn't mean that if you move to this state versus this state, or you cut off these friends or kept a curfew earlier, that also comes back to just that locus of control and the fact that human beings are imperfect and we make decisions that are not super wonderful all the time. That doesn't mean that we need to blame each other for the decisions that we make or the situations that we find ourselves in. And so really focusing on getting rid of that blame and just staying in the present moment. This is where we are right now. And so let's come up with a game plan to move forward and get to a place where we feel hopeful.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number in the description box below, or live chat with us at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, then we'll get you where you need to go. Be well, and remember that change is possible.